source that we're hoping to expand. 97% of the food that we're distributing is rested food that would otherwise go to the landfill. And we talk about the problem of solving hunger, and we don't talk about the problem of solving food waste. So if we can, next slide. Almost everything I know about CACFP or programs to clarify for you that this means an after-school supper or a summer lunch for any child who shows up. And the child does not have to qualify for the program. There's no paperwork forms, there's no ID cards. The site is qualified based on the free and reduced meal eligibility rate. At the we added our CAC report on service is they provide homework help, college counseling, free wine memberships, and a whole assortment of other things. We can scale up this program at no cost to the site that's hosting this, except for the staff expense of supervising the distribution, at no cost to Feeding San Diego, because we're capable of devoting some of their time to finding sites to host these meals, but isn't doing it. The federal government, Congresswoman Susan Davis and Congressman Scott Peters, they've done their job. They have funded this program. And Anahi, you have done your job. You have made the data available for everybody across the county to know. Now it's our turn. It's our job. So if you know of a place where any form of after-school enrichment is happening, whether it's homework help, exercise, or anything, and they're willing to be a host site, we will have our caterer roll in with a hot, nutritious after-school supper, or roll in with a delicious balanced meal for a summer lunch. The only thing that stands between us and 100% enrollment for the eligible youth in these two programs is leadership. So my rallying cry today is Feeding San Diego has staffed this. We have dedicated staff committed to expanding this program. Now we need community partners like Escondido, Lemon Grove, and other school districts, but also YMCAs, libraries, rec centers, community centers, anywhere where there's after-school enrichment to step up and to help us. And if we could slip to the next slide, the last slide. This is Morsich's contact information, which is, she is help us to expand this program. But this should be one of the easiest and quickest things that we can solve for this county. There are many other issues that we have to address for which there is not free federal resources. Here, thank you very much to the Hunger Action Network for organizing this. It's a pleasure.
Thank you so much for sharing your expertise and for sharing resources. Now, open it for questions.
Working together and partnering and supporting you.
Sure. It's gonna be a quick come.
Well, the work is, again, I think that why when I started the presentation that we first need to make the case because all change is difficult. And of course, there's many people involved, and within our school district, it wasn't some of the changes that we were gonna move towards, because I'm sorry, I forgot to mention that we did bring on a summer meal program, after school program, and then also to ensure that every child was being fed, we instituted breakfast in the classroom, which was the most challenging for us. And I'm sorry to say, but it was the teachers who did not want this to happen in our district. So we had they rallied hard and strong against this. But again, thank goodness for the many collaborative partners that we had. Again, making the case for students. This is about students. I think that, again, when we can get behind children and everyone understands that it's about them and it has to be about them. And so it was difficult. And for us within our district, it continues to be a contentious item on the board. It's repeatedly brought back year after year because teachers wanted to go away. So what we have done again is educate the community, and parents even stood against it too once they were presented. It was presented to them from a different lens. But again, is stay the course. Again, my colleagues on the board, having a superintendent, Dr. Berman, and cabinet members who understand it and believe in it is the only way to move it.
why would the teachers oppose this? It's such an amazing program. Great to understand.
In the house? There's many, correct me if I'm wrong, Dr. Berman, but, and the reason I say it is because some of it, what I hear is that it brings rodents into the classroom and then it takes away from instructional minutes. Those are the biggest claims, correct? Anything else?
That's because they're misinformed. The minutes are unaudited minutes it was first started by Jack O'Connell back in 2010 or 9.
Right.
And then Tom Torlakson, he supported it again. And we'll have to look to our new superintendent of education. But the minutes, the 15 to 20 minutes that are spent in the classroom, teachers could be doing roll call or the videos they watch, and they could do some nutrition education, that we could provide them with daily items to share with their kids. So those 15 to 20 minutes are considered instructional. They are misinformed and they're not educated as to why. And when we send them kids who can't learn, they can't teach. So the minute they get kids that are focused and behavior is good, and they're not going to the nervous stomachs problems, teachers now can teach. And that's the message we need to get away, and it has to be grassroots where it's coming from the top and getting all the parents involved.
I agree. Feeding children does not take away from instructional
It
minutes.
does not, and it's
In fact,
it's
it
a
policy
letter.
says it can be included in instructional time.
It is, yeah, it's, the superintendent of instruction has, he totally supports it.
Thank you, Gail. Thank you.
This is for Blanca. I just wanted to know, what did you guys do specifically about the celebration, birthday treats and things? Because we're seeing a lot of issues with that, over sugary sweets. In my son's class alone this week, there were 3 birthdays, with lots of sugar.
There's the instruction.
And so I was recently getting ready to bring this to my superintendent to say, what can we do to reduce or eliminate? So, yeah, school board. I just got on the school board 4 months ago, and there's lots of things that I want to do. Thank you. I just wanted to know how to go about that, and what have you guys done in your district as far as the sugar?
What's your district?
Mason Spring Valley.
Mason Spring Valley.
Yeah, come down and say it's anytime. So one of the things we did is, of course, is we had to look into our board policy, look at our fundraising as well as celebrations, and so it did happen at the board level for us. I didn't do this alone without the support of the board and the superintendent. It could not have happened. But again, I think that if we make the case again, what's going on in our district, so it has to be backed up with something strong and that will be sustainable, which is board policy for us. Is to again state the case. For us, it was the high rates of obesity, and then when we look at the food that we were serving, it wasn't adding. It was adding to our state. So again, to some of the things that we did is that we went to celebrations without the cake and the cupcakes and any sugary item, because then we would be going against our board policy. So we eliminated that, and we came up with different ideas. Send a book to class with your child. Come with your child, bring a book, read it, and donate it to the classroom. Parents, they're creative. They will come up with it.
No pushback from the parents?
No.
Okay.
Well, the biggest pushback actually was with, yes, some celebrations and with the pound of Cheetos for snack, but it wasn't all PTAs. It wasn't, but yes, we did get some.
I
But
know we have 55% of our district is on free and reduced lunch. And they're not sending their kids with nutritious meals. Some of the kids don't finish eating them. The meals that they get from the cafeteria, I think our cafeterias are pretty good. But then those same parents bring these cupcakes and cakes and ice cream, root beer floats after school in the morning.
and something we did also also with that grant is we worked, with several, the initial grant we had was to survey the food that was coming in. So we went really deep with this one. We actually had, someone come in from a research group, and what they did is they collected, because we had the same thing, kids were bringing snacks from home. So we put the trash cans outside with the black trash bag liners. We then, after recess, collected every single bag. We then created a database, if you will, where everything was logged in, every single thing that was being brought by children. And I mean, the biggest thing we had were the potato chips, oversized, Red Hot Cheetos, and is that the 20, it seems like a 20 ounce of Gatorade. And so when you look at those two items, just those two items, what was being brought by children, you know, again, so what we were doing was almost engaging the families by, this is what we're doing by changing our system within the school, but then we need your help and support as well too. And then when we present in the state of their children, even on the fitness grams, that's, you know, we know that we needed to help children.
Blanca, can I ask really quickly, are you a K-8 or a K-12 district?
And I will add, there are many organizations in San Diego County working to change the quality of the meals in school and working to change the wellness policies. So bringing all the stakeholders together and those organizations to the wellness committees is a great place to start, and changing those things that is the culture of the school district sometimes. And we have actually Deirdre, that is with the Hunger Coalition. Well, she's an expert in wellness policy, but you also had a question, right? Yes, please.
Yes, I'm happy to help anyone that wants to know more about your policy and how they can revise it and strengthen it and implement it. But my question is actually for Dr. Spitzer. You mentioned the AAP would like to have food insecurity screening in every health setting. And I wonder about the opportunities in school-based health centers to do some of that food insecurity screening here in San Diego, if you could speak to that.
So that's not an area that we've gone to necessarily, but I mean, the idea, I actually was just at a national AP conference last week in Chicago, and one of the things discussed was like, how far does food insecurity screening go? So there was a lot of discussion about, should we be screening in the emergency room? Should we be screening all hospitalizations? Should we be screening at the newborn, you know, not the newborn visit, but when you have your baby and you're still in the hospital. And I think for not just pediatricians, but the whole healthcare community, there's balance, right? There's, like I said, there's that list from here down to the floor of things to talk about. So we're kind of like, anyone who wants to screen would be happy. So I think school-based centers make a lot of sense, because to me, one of the big things we struggled with at family health centers was who's gonna ask those questions. And we felt like it works better if it comes from someone who knows the family. So it's not the first time they've ever walked into our clinic for a sick visit. Their mind is not on primary care and food insecurity. I mean, school-based health centers, those kids and those healthcare providers, and I'm not just talking about pediatricians, I'm talking about the whole team, the nurse, the front desk, everybody, they have good connections with those families. So sometimes families are more likely to answer truthfully those questions when it's someone they know versus someone they've never met before. And so that partnership with the school-based health service makes a lot of sense. But I mean, the general thing for pediatrics, we're like, well, anybody who wants to ask, we'll support asking. There's no territorial battles on that one. Does that answer the question?
My name is Yvonne Harrison with the SDSU Research Foundation WIC program, and our program follows along with the American Academy of Pediatrics on feeding infants and children 0 to 5. So one of the things that I was wondering is when you're doing the food insecurity screening, where is WIC falling in that questionnaire?
So that's a great question. So I'd say 98% of my patients are on WIC. I mean, so I work down in Logan Heights, so I'm across the street from Perkins Elementary. And that is a question on our well child visit. And it's always yes. So, and I know also because the families are always bringing in that little form asking for the hemoglobin and the baby's height and weight. So we just assume like WIC and SNAP are basically 100% of my patients are eligible. So we're routinely giving out that information. When we do the food insecurity screening now, so our nurses are doing it now, and they automatically generate a referral to our internal, I forget their title. They're basically insurance application specialists. So they help with like Covered California, they help with SNAP, they help with WIC. For our adult patients, there's probably other things they help with that I don't know about because I don't see adults, but that's just part of their kind of armamentarium of tools they have when a family who is positive screened for food insecurity is referred to them. So I mean, to me, WIC is like, if WIC and SNAP went away, it would be as if someone took all the immunizations out of my office. I cannot imagine practicing medicine in the community I practice in if WIC and SNAP weren't the amazing, strong partners for the families.
Any other? Two more. Do we have time for?
Vince, my school district sits, we're 86% free and reduced, but we're in the rural mountain community of Warner Springs, and getting services to us is nearly impossible, and most of our families don't have reliable transportation to get to services. So when you say catering for the after-school program for the dinners, that would be awesome, but are you guys limited on how far out you can get?
Yeah, it's a great question. And the answer is that yes, we can accommodate you. We began to do SFSP program sites on non-gaming tribal reservations 2 years ago. And at that time, our caterer delivered the meals to our distribution center, and then on our own trucks, we hauled it up to these non-gaming reservation sites, one of which is very close to Warner Springs. The second year, they were actually able to absorb that delivery cost into the cost structure. So we actually didn't have to use our own vehicles. And it gives us, though, an opportunity to highlight that we think about the urban areas very intensely, and obviously most of our focus resource-wise is on the urban areas, but Feeding San Diego has made an extremely specialized push to solve rural hunger in the eastern half of San Diego County. So in Guatai and Campo and Boulevard and Santa Isabel, Borrego Springs and Julian, Ramona, there are community at Boulevard, there's many communities in East County where we are operating free distribution sites of rescued food. And it's one of the most expensive things we do, but this is a food desert. I mean, people don't, A, they may not have transportation, and B, if they do, it's not like the dollar store or discount grocery is right down the street. So we have to address those issues that are impacting the children of East County very significantly. So we would welcome the opportunity to have that conversation, and Dana Henderson is standing up by the drapes. So she'd love to talk to you. And by the way, a lot of schools are working diligently to try to increase participation in CACFP or SFSP. In some cases, they want to use their own kitchens, their own staff, but we're there as a gap filler for anybody who doesn't have the capacity to do that. And if they're offering an after-school snack, shame on them, because that's not meeting the nutritional needs. These children are going home to food insecure households where they might not have any dinner. So I really admire you for being here and for asking that question. I hope we can partner.
So much, and not to create any competition to Feeding San Diego, but we need more sponsors in San Diego. So if your organization thinks that you can be a sponsor for serving summer meals or after-school meals, please reach out. We want to help you in becoming a sponsor or a meal site.
Hi, thank you so much. I just had a quick question. This is probably more for Vince, but also for the group. What are some of the strategies that you guys do to sort of think about reducing stigma, specifically for families that are sort of above that threshold, who don't quite, who maybe don't have eligibility but still have this need? And I'd love to hear some more about some of the work you guys do to do that and how organizations can roll that out.
So stigma is a big concern. Obviously, if people, now we really lost Test. Stigma is a really serious barrier for folks that are trying to solve food insecurity. And fortunately for us, we are dealing with, as I mentioned earlier, almost entirely rescued food product. And actually the CACFP, SFSP meal sites are one of the programs we do that does not use rescued food. It's new food product. But amazingly, there's no ID card requirements, there's no paperwork. I mean, we qualify the site, and then any child, even if they're not participating in the program that's occurring at that site, you can qualify a site based on 10 kids getting homework help and feed 100 kids a day. And it's low stigma because they can just walk in and get access to the food. But also with our school pantry sites, with our mobile pantry sites like the East County communities I mentioned, it's not a requirement that there be any registration because we're not dealing with any government-provided commodities that have those requirements, where you have to sign an attestation of income, you have to list your family information, you have to have paperwork on file, you have to be limited generally to 1 time per month. We don't have those requirements. Anybody who self-identifies as food insecure can simply walk up, take 20 to 25 pounds of groceries twice a month. And that is, especially in the current political climate, a real victory for people who have legitimate concerns about accessing food resources. But in general, it minimizes the stigma. The last thing I'll say to them is, by doing school pantries, by setting up free farmers market in the school multipurpose room at 40 K-12 sites across the campus, plus our community college program, which is almost now on every community college in the county, we're meeting the needs of people who don't have transportation. We're bringing food to where they're at, which not only solves transportation, it removes stigma because you're in a peer group. So if we're all parents at this school and we're all getting our kids and we're getting our groceries and we're going home, we're not standing in line on a sidewalk with a large group of people waiting for our turn to go into the food pantry. So meeting people where they're at instead of tasking them with yet one more physical destination to solve their food security is another part of how we're trying to solve that stigma problem. Thank you.
So just for us, you know, in the healthcare community, there's a lot of debate about what we call the active referral versus a passive referral. So an active referral would be, I get you to sign something saying it's okay for someone from 211 or Hunger Coalition or somebody to call you and help you enroll for SNAP or whatever it is that you need to do or get a list of resources. Versus the passive referral, which is our prescription pad. Like, we're just gonna give you the resources. I also, in our clinics, we put out the list of the sites that are doing the summer food program, you know, when that list comes out in May or June. And it's kind of a passive referral. People can pick up the flyer or choose not to pick up the flyer. Sometimes we just include the information on every after-visit summary. So what the family then does with it after that is completely private and up to them. And there's pros and cons, right? I mean, the active referral means someone's gonna call you, and so the follow-through is gonna be higher. The con of that is that some people may be more reluctant to share information, particularly where I work, where the whole immigrant legal kind of conundrum comes up a lot. We didn't want to scare people off, so that's why this passive referral we know is perhaps not quite as effective, but also doesn't scare people away either from stigma or legal concerns.
One of the things we did to reduce the stigma is we moved to provision 2, which meant that all students would be receiving a meal, and it's the same meal. So, and also by removing the a la carte, that meant that all that food, there was no more food for purchase. Everyone in the school district is eating the same food. Everyone has an ID that they enter before they receive their meal, so it's not the free and reduced are on that side. You punch in numbers, and the ones who are not receiving, you go through a different line and you get to buy different food items. No, everyone is eating the same thing. And the board also, to reduce the stigma, when we move to provision 2, it means all of our students are eating, receiving that meal, but the board is now, we are picking up a percentage of that at the board level. And again, that too became what, going back to that earlier, contentious with the teachers. But again, if it's $1, if it's 300,000, whatever the price is on feeding all children, I'm going to certainly at the board level stand on the side where that's just what we're gonna have to fund.
Just
very quickly 2 resources to walk away with, especially for the elected officials' offices. 2 resources that you can give to families in your community. One is a text service, and the number is 877-877, and if you text the word food or comida to that text number, it will give you and it will ask you for your zip code, and it will give you the nearest summer meal site. So that becomes available around June. That is easier. So if people lose their flyer about where summer meals are in their neighborhood, that is something they can do on the go, coming back from the grocery store, whatever. The other one is a mobile app from the California Department of Education called the California Meals for Kids, California